doctors say influenza spread is starting to hit older adults. Recent data from the Public Health Agency of Canada shows that children under 5 still made up the highest number of hospitalized flu patients. But surveillance levels indicate that the rate of seniors being admitted for the flu isn't far behind. Infectious disease specialist Dr. Isaac Bogosh in Toronto says there is a perfect storm of a monster flu season. This without enough people getting the flu shot, as hospitals nationwide are overstretched dealing with COVID-19 and RSV. Well, joining us now to give us a picture of how this spread in viruses may be impacting older Canadians is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here, Nima.
So, Dr. Raut, we're hearing a lot about respiratory syncytial virus and how it's impacting pediatric patients nationwide. But what about older adults? What risk does RSV in particular pose for them?
Right. So we always think about RSV as a disease that affects younger people, and that can certainly be true. If you're under the age of 2, RSV can be very dangerous. But those same infections, when we're looking at an older population, can be quite dangerous as well. If we look just south of the border, the United States, about 120,000 older adults are hospitalized with RSV per year, and about 10,000 of them die each year. So we're still talking about high-risk groups. Those risk groups typically are older adults, especially those 65 years and older, adults with chronic heart or lung disease, and adults with weakened immune systems. So adults can get RSV infections. Typically will have mild cold-like infections, but sometimes it can certainly be much worse, resulting in worsening of the conditions like COPD, asthma, and even congestive heart failure.
Concerning information there, doctor. Now, other doctors are also warning of influenza spread in older adults. But how big of a spike are we seeing in seniors in Canada?
Right. As if RSV wasn't enough, we are now entering the 6th week of the national influenza epidemic. And at the national levels, what we're seeing is all surveillance indicators are steady or increasing. And nearly all of these surveillance indicators are above the expected levels that we would assume at this time of the year. So the spread of influenza is really starting to hit older adults, and the surveillance data is pointing to the hospitalization rates being not that far off from the hospitalization of children. And what we're seeing as well is that the hospitalizations are increasing over the coming weeks as well.
All right, Dr. Raut, and just to add on top of all of this, we're still not in the clear when it comes to COVID-19. So can you tell us a little bit more about that and what demographics are most impacted right now?
That's right. Just to add to all of those, so nationally, we have seen an increase in COVID-19 case counts in the last week. We're also seeing an increase in hospital use by COVID-19 patients. What we find in general, which is very similar to the other ones, is patients in hospitals and ICUs are typically older, usually above the age of 65, and do have comorbidities like high blood pressure and diabetes. Now, keeping in mind, if you look at COVID-19 as a whole, about 75 to 80% of all deaths have been in people aged 65 and older. So very concerning here.
All right, Dr. Raut, and what other options are available for people who must get their flu shots? We know Dr. Isaac Bogosh mentioned that this uptick in COVID and RSV in hospitals is kind of impacting the number of people getting their flu shots.
Right. So what we're seeing is it's a two-part issue. We have a physician resource issue where doctors are working more hours in hospitals, which means less time in clinic to really give their patients the flu shots. But we're also seeing a nuclear family issue because other people in the family are sick. The parents, patients, caregivers are less likely to really focus on the preventive care activities like the flu shot and more likely to focus on the immediate crisis. So the big options are really about physicians, pharmacists, everyone in healthcare stepping up, providing more support for patients, as well as more education on the importance of preventive care here.
All right, Dr. Raut, about a minute left here, but what about individual Canadians or viewers watching this? What kind of steps can they take to stay safe from this triple threat of viruses?
All right. So in the next 30 days, we have Christmas, Hanukkah, Kwanzaa, Boxing Day, Omisoka, and New Year's. So I think the most important piece of advice I can give is that if you're starting to feel that small cold coming, stay home. Don't go to the family gathering. That small tickle in your throat could be RSV, it could be COVID-19, could be influenza. And while you might feel okay, I think our seniors and our younger children might not.
Good advice to consider. Dr. Raut, again, thank you for your time today, and we'll see you again next week.
Thanks so much for having me.